Hey folks, Angela here, your friendly neighborhood educator. I have a quick tutorial on nasal cannula entitled CO2 monitoring for moderate sedation. The items that you have to have are the nasal cannula entitled CO2 tubing. You have to have the filter that plugs into the SpaceLab monitor. And optional, only if your nasal cannula tubing is not long enough to reach the wall oxygen, then you have to have the oxygen extension tubing and the small connector. If you don't have the small connector, the 5-way connector also works. So you take your filter and we're going to plug it in to your SpaceLab monitor. Once you plug it in, you get your green light. That lets you know that your filter is good and that you're ready to begin monitoring. If this is a red light, then that lets you know that something is wrong. And most of the time it's that you either need to change your filter or there's a problem with the tubing, which we have had in the past. Then you plug your small tubing into the filter. And then the wider tubing, of course, plugs into the oxygen. If your patient does not require nasal cannula oxygen but will require non-rebreather, then you omit this step. You won't have to plug the nasal cannula in here. Your non-rebreather will plug right here into your oxygen, and you'll place the oxygen, the non-rebreather, over the nasal cannula piece. Then for the nasal cannula part, place it on your patient just like normal. And then for the entitled CO2 detector, this comes out of the package relatively straight. You just want to make sure that it is bent and pointed towards the lower lip, the bottom lip. That'll make it the most comfortable for the patient, and you'll get the most accurate readings. It does not have to be placed inside the patient's mouth, just bent enough to point towards that lower lip. Since this is moderate sedation, please don't forget you have to have your patient on the cardiac monitor, of course, pulse oximeter and blood pressure, and that you are documenting these according to moderate sedation guidelines along with your capnography reading. Also, prior to procedure, we know that the provider must obtain consent, and that form is signed, that the timeout is completed prior to procedure. Your pre and post Alderet scores are documented, and your Alderet scores are documenting during procedure as well. Prior to procedure, the provider has to document the ASA score. And then last, make sure that you have the crash cart at bedside. And just for the propofol, remember nursing staff is not permitted to push the propofol during moderate sedation. According to the FDA guidelines, it's classified as a general anesthetic, and according to the Oklahoma Board of Nursing and the Nurse Practice Act, we do not push general anesthetics. So please make sure that the provider is pushing the propofol and that you are documenting that the provider administered the medication. If you have any questions, please let me know. Have a great day. Bye.